mode.
Hello, my name is Jen Weaver, and we would like to welcome you to our webinar for March. On behalf of Advancing Evidence-Based Practice, we are pleased to present Sharon Mahalik. She will be demonstrating the new Blueprints website for us. During the webinar, if you need any technical assistance or have any concerns, feel free to type a question into the question box and I will respond to it. If you have questions about the presentation, you may type those in as well, and we'll address those at the appropriate time. Sharon Mahalik has been a researcher at the University of Colorado for 22 years. During the last 16 years, she has been director of the Blueprints for Violence Prevention Initiative and has had major input into selection of the Blueprints programs. We are excited to have her here today, and we will now turn the time over to Sharon.
Okay, well, hello everybody. As soon as we get this turned over, I will bring up the website. Let's see. Okay, here we are. So first of all, let me just kind of briefly mention a little bit about what's new for us. You can see from the very top here in your icon that we are now known as Blueprints for Healthy Youth Development. Of course, we used to be known as Blueprints for Violence Prevention because we had this historical focus on preventing problem behaviors such as violence, substance use, delinquency. But we are now funded by the Annie E. Casey Foundation, and as a result of that funding, we've expanded into a focus on positive youth development. So we've expanded our scope of outcomes now to also look at positive relationships, academic success, and mental and physical health. Also, we've changed our standards slightly, but I'm going to talk about that a little bit more when we get to the section on our criteria. So as we've been sitting here, you may have noticed some rotating pictures to begin with. Each one of these pictures, basically you could click on, but each one has to do with one of the menu bar items up here. Like here, if you were nominated programs, the same thing as if you clicked out here, nominated program. So these rotating pictures just coincide with the menu bars, and you can either click up here or you can click down here on the picture. Also, you'll notice as we go through the website that the pictures that we do have all kind of depict aspects of healthy youth development and those healthy youth development outcomes. So I want to start actually today with going through the menu buttons up here at the top of the page, and then after we go through those, then we'll have a time for some questions, and then during the second half we will look at the search menu. So let's start right here with About Us, and basically this is just a little bit of information about the Center for the Study and Prevention of Violence, and of course Blueprints is housed in the Center for the Study and Prevention of Violence at the University of Colorado. If you want some more in-depth information about Blueprints, you can go here to the frequently asked questions, and there are a number of things here that you can click on and get more information about. Okay, the Assess Needs page. You know, we list 3 different types of assessment surveys. And basically, the purpose of assessment surveys, these provide tools for a community to be able to identify their risk and protective factors. And then once risk and protective factors are identified, those communities or schools could use the website to match those needs to their programs. So we list 3 assessment surveys here. Annie Casey has actually a series of 3 surveys. We only have 1 up right now because they're still working on the other 2. But the one that we have up is a school survey. We have the Communities That Care Use survey. that many communities use to assess risk and protective factors. And then our center has a school climate survey, and it's for students, staff, and parents. And after the students go in and do this survey, we actually generate, it auto-generates the answers to the questions in kind of a nice format that schools can use. So you can utilize those types of things, you know, if you want to assess the needs in your schools or in your system or community. Okay, next is the Blueprints criteria. And with regard to Blueprints criteria, we look at, well, we have, you know, all of the, basically on this page we have sort of a brief description of the criteria. And, you know, we can go through these kind of 4 things here. Basically, we look in all of our programs at these things, and every program has to kind of meet these criteria. So let's just kind of look quickly at each one. If we look at intervention specificity, we're talking here about, you know, is the intervention focused, practical, and logical? So here we might be looking at the risk and protective factors or mediators to see, you know, if there are outcomes, you know, upon the things that the program developers think they're impacting to make behavioral changes. We also look at evaluation quality, and when we look at quality of the evaluation, we're really looking at a number of things. You know, we're looking at such things as the way the samples were selected. We're looking at whether the unit of analysis is correct. Have they accounted for clustering? We're looking at attrition, and is there differential attrition in a sample? So we look at a large number of things, and if you're interested in seeing that, we've put our checklist out here. I'll just kind of show it to you real quickly. This is a checklist that our writers use when we are writing up a study, and we kind of look and see, are the measures valid, reliable, you know, is the analysis done at the proper level, does it control for baseline outcome measures, is there baseline equivalence between conditions? So there are just a number of things that we look at. And then, of course, we want to see an intervention impact on those outcomes of interest that Blueprints has. That's, you know, in the areas, again, of problem behavior or positive youth development, positive relationships, academic success, and mental and physical health. Now, new to our criteria, because in the past we had listed some programs on our website before that weren't always ready for dissemination. But we had listed some because, you know, we felt that there was a scientific reason for listing them, and that people could use those programs perhaps to develop new things to do in their sites. But our criteria now requires, before we list a program, that it be ready for dissemination. So we want to know that each program has the necessary organizational capability, they have manuals, they have training, TA, and they have support to implement that program with fidelity. So it also has to meet that criteria. So promising programs will have one randomized controlled trial, or it could be, there could be 2 quasi-experimental designs with high quality. And again, you know, we're looking at all these things in quality. So to become promising, you have to have at least an RCT or 2 QEDs. Now, in our old criteria, we only required 1 QED or 1 RCT, so there's a difference there. Now for model programs, we require 2 RCTs or 1 RCT and 1 QED, and again of high quality. The old criteria, the evaluations could be, both of the evaluations in our old criteria could be both QEDs, although that rarely happened. So now we need at least 1 RCT to fit the model program criteria. And I might add, as we're here on the criteria page, that there's always the tensions between having rigorous criteria and having a weaker standard. I mean, there's some folks that would argue for having a weaker standard because they really want to have more programs on their registry. We argue, of course, for having a really rigorous standard because, there may be fewer programs, but that comes, there's just less risk of failure later on as we find out and gain more evidence, for programs. There's less risk of those programs having to be removed. And you really want a rigorous standard before you take these programs out to scale. So we just always argue for having a very, very rigorous standard. Okay. Let's go now to the next menu bar item, and I'm going to skip these two for right now, the Blueprints programs. We'll come back to that. But let's go to the Nominate program. And here basically it just shows you how you can nominate a program. It shows the steps in the process in case people want to know, how much time it takes to get their program reviewed. The key here is that I want to mention is that we do more than just accept nominations. In fact, most of our programs don't even come from nominations. We actually do a monthly search of the journals and a monthly keyword search to try to find the prevention research literature out there. We accept nominations, but we do this very thorough review. Some registries only review those articles that are submitted. Well, the way that we do it by searching the literature every month, it really eliminates bias in which programs are listed on the registry because, if the developer is only submitting the articles that they want to select, they may not even send in articles that have no effects. Also, this kind of, the way that we do it ensures that there are programs that are effective are not overlooked. And you can see over here we list our advisory board members. We have a very distinguished board of advisory board members, Thomas Cook, Dale Elliott, Francis Gardner, who's in England, Denise Gottfredson, David Hawkins, and Patrick Tolan. We recently lost one of our board members, Steve Ose, who had been on it for quite a long time, who does cost-benefit stuff, but he's very busy with his legislature in Washington and just didn't have the time to review programs with us anymore. So our process, just to let you know what the process is, we review programs internally. We do thorough write-ups of the programs. And then we make a decision here as to whether we think it meets criteria. And if a program does meet criteria, in our opinion, we take it to the advisory board, and then they do a very thorough review of all of the research. Okay, the resources page. We have a place here where you can go to our center publications, and the center publications focus more on youth violence and school safety. And then we've begun listing publications that the Blueprints Project has done. We don't have other people's work on here at the current time. But most of these are about effective evidence-based programs, or they're about replicating those programs and implementation fidelity. But the more important part here, I think, is that we have this listing on our website of federal and privately rated programs. And let's just go over to that. you know, as you know, there's a lot of registries of programs, and they often vary in focus and criteria. So it's often difficult for people that go on sites and see these programs to really understand what they're looking at, or, you know, what does it mean to be evidence-based, and why is a program listed here and not listed here. So this can kind of show people, help them to understand. They can look at an alphabetical list of programs that have been rated by across 7 different agencies and see how they're rated across these agencies. And you know, at the bottom of this, we show, you know, for each one of these agencies whether they are, well, let's go to the bottom and just look at that. You can see here, like the Coalition for Evidence-Based Policy, they rate top tier and near top tier. Blueprints rates model and promising. So you can see in each agency what is the top tier type of program. And then, you know, you can just look at your program and you can start seeing, you know, a program that's rated very highly across a lot of these agencies may be a program that you might want to look more carefully at. So that matrix can be pretty helpful for people. And then if you're interested in the criteria that's used by each of these agencies, we list that. So we talk about, you know, what it means to be top tier and how a program becomes near top tier. So you can find out the criteria also. Okay, I want to go back now to the Blueprints programs, because now we're going to start getting into the kind of more in-depth information on the programs that we have on our website. You can see right now we have 44 programs of model and promising. And if we go through here, just kind of looking at these. So I'm just going to go through life skills training, because we replicate life skills training in a lot of states, so I'm pretty familiar with this one. But as you can see, we have here a very, very brief description, and this brief description is really intended to be only a couple of sentences, and it just kind of tells you what the program is in a nutshell, and it also includes the goals of that program. So it's a lot to get into just a couple of sentences, so it's very brief. Here we have the outcomes that have been achieved by that program. Here you see we have benefit and cost information. If it's shaded, we don't have the information. So this one has it. You can see for life skills training, the program benefits per individual, the program cost per individual, and then the benefits minus the cost. And then we have the odds of getting that type of benefit cost number. So pretty good odds here that you're going to have a pretty good benefit on this program. All of these estimates come from the Washington State Institute for Public Policy. I'd mentioned Steve Ost used to be on our advisory board, and you know, he's been kind of the source of putting all of this information together. So they have this information. If you click on the more, you'll see kind of their disclaimer on this. Let's get rid of the feedback survey, but if you wanted to take a feedback survey, you could do so, and your feedback button, you could do it at any time by clicking over here. So that's the benefit and cost information. This is a model program. Let's close that up. We have information that you can click on here on basically the target population. This is a universal prevention program targeting middle school, all races, and both males and females. So it gives you a quick snapshot of the target population. Now, if you click on project information, you're going to start getting into more in-depth information on the program itself. This is basically a fact sheet for the program, and you can see on the top part of this fact sheet we have the outcomes that have been achieved by the program, the type of program that it is, the setting, it's a school setting. This information in here is pretty much target population information, age, gender, race, universal program. The endorsements, who to contact if you want information on the program or you want training in TA. And then we put the developer of the program, Gil Botvin, and we're not listing his contact information here. We just kind of made a decision that we probably really want people to contact here, and that the developers might not want to get bombarded with a bunch of calls. But certainly if you wanted to find out more, you could look up Gil and find his contact information. Plus you could find it later on more in depth on our website. If we go down the fact sheet, you see that we have a brief description of the program. We have brief bulleted outcomes for the program. And we have something here that most people don't put on their registries. We have some information about the race, ethnicity, gender details. So if any of the studies that we've reviewed, if they've done analysis by gender or race, or they've tested interactions and they found specific results related to a specific gender or race, ethnicity, we put it into this block of information so that people have greater information, because people are always asking, well, does it work for, you know, Latinos or this group or that group, or does it work for females? Risk and protective factors, you uncollapse the category here and you find the risk factors and then the protective factors that this program targets. If there's a logic model for the program, it'll be listed at the bottom of the risk and protective factors. In fact, this one does have a logic model that we can click on. Pretty detailed logic model. We have information on training and technical assistance. And if there's a certification process, that's also going to be listed down at the bottom of this. And then we have the brief evaluation methodology. In a study, in a program like Life Skills Training, it can be a challenge to write a brief evaluation methodology for, you know, a program that has, you know, 18 or more studies. So something like this tries to summarize very quickly over across all of those studies. A lot of the programs will have, you know, maybe 2 evaluations, and when we have the brief evaluation for that, you'll find more detail related to each of those specific evaluations. And then the references. So that's the program fact sheet. But you can also go to a program cost fact sheet. And in the program cost, you can see that we start with startup costs. So we have cost of initial training and technical assistance, the cost for curriculum materials. If there were licensing fees, there's not in this program, but there would be in a program like multisystemic therapy, that cost would be there, and any other type of startup cost. Then we go into intervention implementation costs. So there are ongoing costs for a program. So the ongoing costs for curriculum, staffing, qualifications, ratios, time to deliver. And then there's costs related to support and monitoring. So there might be costs for fidelity instruments or whatever. There might be ongoing quality assurance costs. That would be listed. And then we have in every one of the programs, we go through this similar structure in all of the programs, but we always have a year 1 cost example too. This one's kind of simple because life skills training costs are fairly simple, but we have the cost of on-site training, the trainer travel, and then the classroom materials cost. And then we come up with a unit cost. So we are using as an example in this one 10 teachers, 20 classrooms, 2 classrooms per teacher, teaching 60 students. So with 600 students taught, the cost per student would be $16.75. In a program like MST, there would be more things listed here. They would have the cost for, an average cost per therapist, and benefits, and even the overhead cost included, so that you could kind of come up with a year one cost example. And keep in mind, that's only year one, but we do have the ongoing cost up embedded in here. We just feel like a lot of people want to know what it's going to take right up front to get this program going. And then we have a fact sheet for funding strategies. We have the funding overview there, but the strategies that we're looking at are existing funds, state and local funds, and maximizing federal funds, foundation grants, public-private partnerships, generating new revenue. So the structure of this is the same on each program too. So it gives people ideas on where to go for funding and what type of strategies can be used for funding. And then we have something again that nobody else has. This actually comes right out of our database. These are the write-ups that we do here internally. These are write-ups that we've always done for every program that we review. Basically, you'll see a lot of the information. You know, here's designer, developer information, the program outcomes. The stuff that you saw in the fact sheets basically come right out of here. The age, gender, so on, risk protective factors. But what you'll find, the description of the program, the theoretical rationale, but what you'll find, mediating effects, generalizability, limitations of studies, but then you'll find, you know, maybe you don't have access to all the journals, and you're really interested in the program, and you really want to kind of research out for yourself what happened in each of these studies. We have written up every study. So these are the write-ups that we do, and we start with the evaluation methodology, the design, the sample, the measures, the analysis. We go into the outcomes, all of the outcomes for study 1, study 2, study 3, and so on, in, you know, as many studies as that program has. And a program like the Incredible Years, the parent program, I think we have 34 different studies in our write-up. So you can get very in-depth information if you want to look at that. And then if there is a video, you can click out, and this one has one. We're not going to click into it. But the programs that have a video, you'll be able to click out to that and see, you know, kind of a brief. They're all different. Some of them might show a sample of what it's like to implement the program in the classroom. So they're each a little bit different. Okay, program search we won't go into. We'll look at program search as we look at the search options on this page. So it's just another place to click into these search options. So we'll do that in the next half, but at this point I would like to just open up to any questions that you have so far.
It looks like we don't have any as of yet, but we'll give that a few minutes.
Okay, well, shall I just move on then into the searches and demonstrate that, and then we'll see at the end. We'll have another chance for questions at the end, okay? All right, first of all, let's move down here. There's 3 ways to search. And let's just do the kind of the simple one here, a keyword search. Everybody knows what a keyword search is, but you know, if I was to type in bullying, it's going to bring up 3 programs. Okay, 2 of these programs are actually bullying programs. The Incredible Years Teacher Classroom Management Program is not really a bullying program per se, but it came up in the search because in this program they develop classroom rules around bullying, so that comes up. So anyway, you could do a keyword search. You could put in there the specific name of a program and just bring up the program that you're interested in, or you could search on some term that you might be interested in. Okay, here you'll see that we have a step-by-step approach to find a program that fits your needs, or right here you can see skip our step-by-step approach and go directly to our program selector. They're both the same program selector. It's just one holds your hand through it. And we decided to do it this way because we felt like some people will come on a website and they won't have a lot of experience with it. And if they went here, they might not really exactly know what they're doing, and they just need a little more hand-holding. So they might want to stop here. But I can kind of I think I can pretty much guarantee that once people use this one time, they're going to end up over here. And you'll see this in a moment. But let's just start with the step-by-step approach, because this gives us an opportunity to go through each step that's in our program selector. So you can see our 5 type of outcome domains that Blueprints is now interested in. And let's just click on 2 of them so you can see what happens. And we're going to continue. We clicked on behavior and education. When you click on that, you see then all the specific outcomes for behavior. This is where you get your alcohol or delinquency conduct problems. Education outcomes that we're interested in, the academic performance, early cognitive development, high school graduation. So a person can, let's say this person is wanting to search for a program that has to do with alcohol use. And let's don't search on education. So let's just continue on to step 2. And you can see up here, step 1, we chose behavior and education, but in step 2 we only chose one outcome, alcohol. So it's tracking what you're selecting up here. So you can select by the age grouping. I think we want an alcohol program that targets middle school students. You could select by race, ethnicity. So if a person, say a person wanted to come on and they were interested to see if Blueprints had any programs really just for African Americans, they might just come on and choose that and then display all the programs to see what do we have? Do we have anything there for that specifically? You can choose by the type of program recipients, or you can choose by gender. Again, you know, we worked in a project a couple of years ago with a girls' study group, and certainly they were interested in female programs. And so, you know, they would be able to come on, click female, and bring up all programs that either were specifically for females. So you could choose that way. We're going to continue on to step 4, and in step 4 we list the type of program. So again, let's say you are a family-based organization. You might want to come on and select family therapy. Maybe that's an interest of yours, and you want to see all the programs that are family therapy. You could do that. Or you might want to come on and just select, you want to know what all the bullying type programs are. You could just select and display that. You can also select by center. If you're a school and you're just interested in all the school-based programs, you could do that. And then you could select by the continuum of intervention, what population is targeted to receive the services, universal, selective, indicated, treatment, maintenance. So we're interested now in an alcohol program, middle school, that's universal. We want it to go for the entire population. Let's continue. And our last step, our risk and protective factors. And some might argue that it should be the first step. We wanted to put it last because it's pretty involved, and basically we didn't want people up front starting to select a whole bunch, you know, just marking in a whole lot of risk and protective factors and then coming up with such a very narrow list of programs. So If you click on individual, then you come up with all of the individual risk factors that a program might target and the protective factors that the program might target. If you don't know what specific risk and protective factors you're interested in, but again, you know, maybe you're a, let's not do that, maybe you're a family-based organization and, you know, you just want to see every risk and protective factor, all the programs that target any of these. You could just select up here and get them all selected and then bring up all of those programs. We're not going to select on risk and protective factors. We're going to pretend that we don't know what our risk and protective factors are, and we're going to display the results. So when you display the results, again, we searched on alcohol at the middle school. That was universal, targeted the entire population. We came up with 9 programs. These are the programs that came up. And now you can see your program selectors over here. And it's got alcohol, each of these things that we selected on. So if maybe we looked at some of these things and, you know, if we want to revise our search, we can do it right here. So let's say, well, you know, maybe we also want to see those programs for kids that are at risk in addition to, you know, the universal ones. Well, we added 3 more programs when we added in programs for kids that were at risk.
Sharon, a quick question.
Okay.
Let's say you wanted to be able to tell how many Blueprint programs were being implemented in your specific state. Is there a way to do that? We have one person wanting to know, for example, how many are being implemented in Texas.
Oh, okay. No, we can't do that. And the reason we can't is we really don't have that information. There are, you know, for sure there are like 4 of the Blueprint model programs that track, you know, where all of their sites are, and they're tracked. Those are for like multisystemic therapy, functional family therapy, treatment, foster care, nurse-family partnership, because those sites, they typically have license agreements. They know exactly where they're implementing, but when you have a school-based program, I have to say that sometimes, you know, sites they buy the materials, they may even do the training, so all the developer may know is that, well, they've sold materials to that site, we gave them a training, but they don't really know if they're implementing because there's really not a lot of feedback, you know, to the developer in some of these school-based programs. So we don't track that, and we can't provide that. We just don't have that information.
Okay, thank you.
Okay, so again, you know, you could make any changes over here that you want to make. I'm going to take those out. I'll take out the early middle school because maybe all I want to see are alcohol programs. If all I wanted to see were alcohol programs, then I could come up with a list of all the alcohol programs. You know, again, a lot of people will do those assessment, a needs assessment. So some people are going to come in having assessed what their risk and protective factors are in their community, and they know they prioritize, so maybe they prioritized that their primary risk and protective, they want to target in their community poor family management. So they can come in, choose that, and they can come out with all of the programs then that have targeted poor family management and start, you know, narrowing a list of programs that they want to implement in their communities. And then one more thing I want to show you, there is an option to compare programs. So if you have a long list and you've looked at some of the things in here, but maybe, you know, you've decided that, you know, you just, I don't know, you want to print out some stuff. You can kind of compare, narrow that down to the 3 programs you're interested in. So maybe you want to open up, you know, so at least some of this information. You could print this out then and be able to take it to other people to show.
Sharon, two quick
Yes.
questions regarding that. Is this a good time?
Absolutely.
Okay. So with the matrix comparing list, has that been updated?
Has the matrix comparing list
Mm-hmm.
been updated?
Yes.
The matrix? We're talking, this is the, oh, I'm sorry, the matrix of federal programs. I assume that's what the person is talking
Yeah,
about.
I
Has
believe
that
so.
matrix that we showed earlier under the resources page been updated?
Right.
The blueprints programs on it are up to date. The other agencies were done last year, and we will update that in about a month or two. We can't keep that updated continuously. It's quite involved to actually go into every list, and it's not like we get, it's not like somebody notifies us every time they add or delete a program off of one of the registries. So it actually is quite an involved thing. So we only update that once a year.
And then as far as the program list, when someone completes a search, what order are those programs listed in?
Okay. The programs were listed in alphabetical order. So you can see, like here on the matrix, they're in alphabetical order. We're doing some programming right now that you'll be able to click right here on rating. I think that's where it's going to happen, so that you can sort then by model and have the model come up. Actually, I'm probably wrong on the search. I think it might. Let's do a search real quick. I was thinking they came up in alphabetical order, but let's just make sure that I'm correct on that. But let me finish on this one. Right here, they come up in alphabetical order, but we're doing the programming right now so that you can click, probably right here, but I'm not sure. It might be somewhere else, and it'll sort by model or by promising. So we'll be able to do that. Let's do a very, very quick search again. And let's just go over here to the program selector. Let's search by age, and let's say late childhood. And let's display those programs. And okay, so I was wrong. They come up, model programs come up first in the search, and then promising programs come up. Okay, so let me just, are there other questions?
Well,
I think I've showed pretty much how the website works now, and I think I've showed all the options on it at this point. Do y'all have any other questions about it?
we do.
And one more thing, you can kind of see how after you've gone through the step-by-step search, to me it's just easier to work over here once you have everything up there, and you kind of know how it works by that point. But it does give people an opportunity who don't know when they initially come onto a website, to have a little bit of hand-holding through it.
Also, there's just a comment that on that matrix, there is a cell that shows the date when they were updated in the upper left-hand corner.
Yes, on that matrix of federal programs, there's a date in the very left-hand corner. You'll see there's two dates, actually. The blueprints you'll see was updated. It's up to date, the blueprints programs. The rest of them were last updated last year. Like I say, we are due to update that again in about, we'll update it again in about a month or so.
Okay, I have a lengthy question. Are you ready?
Okay.
Okay, this is a good one. It says, this is a really helpful tool, but I'm struck that it does not include some programs broadly considered to be evidence-based, for example, in the realm of home visiting, and others that have elsewhere been deemed evidence-based, like Triple P, are only considered promising in your model. With various clearinghouses and federal agencies deeming programs evidence-based or not, how should folks reconcile different determinations by those entities?
Okay, well, that's kind of where I was getting at, that, the registries that are out there Well, let's just go to the registry here. Okay, and here's the update dates up here. You mentioned like triple P. Triple P is promising on our list, and actually that's triple P, the system of triple P. Triple P, just the parenting type of program, hasn't even made our list at all. It's a whole delivering the entire system in a community that has made our list. And it has to do, again, with the way different agencies, the criteria for different agencies and the way they assess that criteria. For us, on that program, nearly all of the evaluations of triple P parenting, the person who, the reporter for the outcomes was the parent, the mother, and the mother is the one who's receiving the intervention. So for us, that's a major flaw, and we did a major review of all the different studies, and the few that had a different reporter reporting on the outcomes, just the couple that had those, there weren't any results typically for the program when there was a different reporter. So it really has to do with kind of the criteria that an agency sets. And Blueprints, I have to say, I think that Blueprints is probably the hardest registry or list out there to get onto, because our criteria is rigorous, and our advisory board really does look at all the quality of that study and really, assess, whether there are alternative explanations for that. So, so probably, if we've reviewed it, there's always a possibility that we haven't reviewed a program, and, I get, emails all the time, have you looked at this or that, or people send something, and, we will obviously review things that we haven't. But I think most of those differences just come from the amount of rigor that our registry has, and we feel that that rigor is necessary because we don't want these programs to go out to scale if they're not ready. And we've experienced that ourselves in previously when we first started Blueprints. We had some programs on the list, and later evaluations found, high-quality evaluations found that they just really didn't make the grade, and we've had to remove programs. So I think that there's a danger of putting programs on too early. So I hope that answers your question, but I know that it's a hard argument to make to some people, because they're really, a lot of people believe that the rigor that goes into these registries should be lessened because they do want to see more programs. But we don't want to see the programs taken to scale until they've been proven, and we just think that that's very important to do.
Follow-up question on that says, there seems to be a few reading, literacy, or educational programs that make the Blueprints list, but no other list. How might have that happened?
Well, my guess, if that's happened, I'm guessing that those reading and literacy programs may not be a focus of some of those lists. As you know, last year it wouldn't have been a focus for Blueprints, so you would not have seen it on our list because we didn't review those programs. Now, it's a different matter if you're saying they're on our list but they're not on the What Works Clearinghouse, for instance, the Department of Ed list. But I don't know for sure, but I'm guessing that these reading and literacy programs are out there. But please, if you're a participant out there and you know that that's not the case, you can always, email me and correct me if I'm wrong on that. But as far as most of the other lists, I'm guessing that they just haven't been reviewed because it's not a focus of their outcomes that they look at.
Okay, a few more questions here. Why has a program such as Incredible Years Parent Training that was previously model rated been demoted, so to say, to promising?
Okay. You know, as I did state earlier that our criteria has changed slightly, and I have to say, like for Incredible Years Parenting, and this one was a very tough one for us because there are, we have 34 studies of Incredible Years Parenting. The problem for us was sustainability. And even though they do have some studies that show sustained effects, I mentioned that a very important part of what we look at is the quality of that study. And, a couple of those wouldn't have even come close because a couple of them had other components. It wasn't just the parent training that had been done. It might have been parent training combined with something else. So those kind of got ruled out immediately. And then, we were left looking at, I think maybe 2 studies, and ultimately going into kind of in depth into one study. But ultimately there were just things about the methodological quality of the study that this time around we just couldn't say that those effects were sustained, and because of the program that there were other things operating in the methodology that we just couldn't rule out. So that one moved from model to promising, but hopefully it won't stay there long, and that now that Carolyn and others know what's required. The problem, Carolyn Webster Stratton had historically used waitlist control groups. She actually has a lot of studies that show maintenance effects, but they're always with a waitlist control group. So in other words, the control group was lost and got the intervention. And so for the 1-year effects, you were looking at, just what's the effect being maintained in the treatment group from the end of the intervention to the end of the 1 year. So I'm very, very hopeful, and I think there might even be a group in Colorado that may want to try to do a good evaluation with, trying to prove the sustainability of the program. In other cases, a program might have moved because of the replication issue, but that's not the case with Incredible Years.
Is there anything being done to promote the use of the updated list and website to state or federal policymakers or legislatures?
Would you repeat that again?
Sure. Is anything being done to promote the use of the updated list and website to state or federal policymakers or legislatures?
Oh, okay, to promote our new website?
Yes.
Yes. We did have slated for next week, but now I think it's moved back to the following week. We're going to do a press release on I think it's the 25th now, although I'm going to talk to Annie Casey and see if they want to move back to the 20th. We did have it slated for the 20th, but our university has asked that it get moved back to the 25th. So 20th or 25th, there's going to be a national press release, and then we'll do another press release in the state of Colorado. So that's when we kind of plan our official rollout of the website. So we're doing a number of things. We are going to be contacting different federal agencies and asking, to talk to different people and how we can demonstrate the website to them. Of course, we're doing these webinars. I'll be doing one for the state of Pennsylvania next month also. We're trying to put ads into some of the trade journals that go to these different agencies and some of these new markets, because we haven't been in the education market before. So trying to figure out who to go to in there. Are there certain trade journals that we should put an ad in? There is actually a huge rollout being planned, and Annie Casey's actually been a great help with all of that. So I think you'll be seeing a lot of blueprints over this next year, because I think there's huge promotion efforts being planned.
There's also a suggestion on here to consider adding a function that allows networking or information sharing between people implementing a given program. Any thoughts on that?
Obviously a great idea. I'd have to think about how to implement something like that, but yeah, it's obviously a great idea. That, I mean, I know we see that when we implement, do a lot of life skills training, and I know that, you know, in times past, teachers have asked to be able to at least have a method to interact with other teachers at other sites. So yeah, I think something like that would be great. Now, there is a Twitter account out on our Blueprints conference website that you could access. So that might be one way of involving people and getting communications going. But yeah, it sounds like a great idea. Networking is always a great, wonderful idea.
And
thank you.
do you have any plans to look at implementation evaluations to know whether these programs are delivering in the real world and with differing populations?
Well, we look at all evaluations. So, you know, any evaluation that is ever done, you know, on a program, we're looking at it. So most of these programs, especially the model programs, do have real-world evaluations. And, you know, more and more of them have independent evaluations that's not done by the program developer. So, you know, I think there's getting to be more of a trend for that. I'd like to see a lot more of that. But we definitely look at that, and it's I think if you look at all of the different studies in there, you could probably see that many of those are real-world evaluations.
And just one last question before we launch a few polls. Are the cost details in the program descriptions the same information used by WSIPP to calculate ROI?
Yes.
Okay.
Those cost calculations are done by the Washington State Institute for Public Policy. So everything you see there, you can find those on their website too. They put out a report. I think they just put, these are from the latest report. So there's some consistency across every program in how they calculate these things. Well, I hope that answered the question.
I think so.
Okay.
Thank you, Sharon, so much for being here with us today. We're grateful for that. We know that there was a lot of excitement regarding the new Blueprints website. At this time, we'd like everyone to take a moment to answer a few questions. I'll be closing our webinar poll in about 3 to 4 minutes. Also, remember to join us next month for our webinar on MST presented by Joe Boggs. We will now launch the poll. Okay, we're heading into our next poll question here. Was the material well presented? Wow, Sharon, you might like to know you got 100% feedback on that it was well presented.
Thank you so much. Thank you. I appreciate that very, very much.
And just 2 more questions. One, will this be useful? Will this information be useful? Go ahead and look at your polls. Great. Another 100%. Thank you. Our last question. Our last question is just, would you like to learn more about this material? Thank you so much. Again, another 100% yes on that, so I'm sure you're happy to hear that, Sharon.
Absolutely. I very much appreciate that.
Well, thank you again for joining us today. If you like what you've heard today and would like to share this information with your colleagues, feel free to visit our website in the next couple of weeks where you may find a recorded version of today's webinar. And again, make sure you join us next month for our April webinar on MST. Thank you and have a great day.
Let me say
go
one
ahead.
more thing. If you'd like to do the feedback survey on our website, if you could just go on to www.blueprintsprograms.com. Certainly appreciate any feedback. Feel free to do that. We're still doing beta testing, so there's still opportunities for input. So I appreciate everybody. Thank you so much.
Thank you, Sharon.
Thank you.